Medical resources are dangerously low in Yemen. It's a major concern for health authorities, particularly in densely populated cities.
We don't have the necessary medicines or ventilators. So how are we supposed to treat COVID-19 patients when we don't even have the basics?
Many hospitals have been forced to shut down. For those that remain open, medical supplies and fuel for generators are dwindling.
The dialysis machine cuts off during treatment sometimes. Why? Because there's no electricity.
When the machine's cut off, we're forced to move the bloodstream manually to prevent any clotting. We try to do our best.
The conflict that's persisted for more than 5 years between Houthi rebels and the Saudi-backed government has escalated in recent weeks. The UN says more civilians were killed in August than any other month this year, and medical facilities, already struggling to deal with people injured in the conflict, don't have spare rooms for COVID-19 patients. Yemen's reported just over 2,000 coronavirus cases, but doctors fear limitations in testing could mean the actual figures are a lot higher. What's of greater concern is the death toll. More than a quarter of its COVID-19 patients have died. It's an indication of how ill-equipped the healthcare system is. And the outbreak is having repercussions far beyond those it infects.
The pandemic is making it even more difficult and dangerous for humanitarian workers to reach Yemenis with life-saving aid.
In an effort to boost the healthcare system, the Red Cross has opened a coronavirus treatment centre in the southern city of Aden. The 60-bed facility includes an X-ray room, care wards and a laboratory.
So the center will be a facility that will be able to treat patients that currently have very few options, if any, to obtain adequate medical treatment.
The organisation says its new facility won't have the same problems as other healthcare centres, like a lack of equipment and power outages. But officials say a lot more is needed, including a nationwide ceasefire, before Yemen can truly begin to heal. Reagan Des Vignes, TRT World.